a day, we receive over 100 patients, and you find that you are 2 people on duty. So that ratio is not balancing at all. So you find it's challenging. You are supposed to work 8 hours in a day. Sometimes you find that even your time for going off duty or going home has reached, but still you have so many patients to work on. So the workload is much, actually.
What do you have?
The hospital has no problem. The problem is people are sick. Yeah, actually they are very sick. Yeah, the hospital has no problem. They try their level best to make sure there are nurses on duty, but still, even if you are 2, the work is much. You will not finish all. Still, you leave when others are still crying.
What is your appeal to the government? What's that?
The government, yeah, if they can recruit more, you find that when you have 4 people on duty,
7, depending on the work overload or the turn up of our clients. Because you may find that you've been on day duty, but the evening person who has come at 2 is also 1, and the ward is not all that fine. You cannot just leave those patients. You end up giving a hand up to around 7, or sometimes even up to 6, then you go back home. So tomorrow also goes like that, depending on the turn up of the clients. If the clients were few, you can leave at 5 p.m. because that's the normal time schedule of our duties. You can come at 2 and leave. We are supposed to leave at 8 p.m. But sometimes, depending on the turn up and the need of health workers, you cannot just go when there are other critical people who need your attention. You can push up to around 10, then you leave. You go back home. When it comes to night duty, I always report at 8 p.m. and push up to 8 a.m. in the morning. Yes. Turn up of the patients. Actually, the turn up depends on the admission is in casualty, because for us here we don't admit, but we receive transfers in from casualty. So, depending on the high turn up in casualty is what we base on here. You may find that in a day, as a medical ward, you can admit like 30 sometimes, or you can admit like 20, depending. If casualty is full, they have no beds, they end up pushing everybody this way. Yeah, in fact that one, it has happened severally, whereby I've saved a number of patients, and I would wish still to happen. But the day I did it, in fact I felt so good, because I saw that person's life being saved. However, when I lose, I really feel demoralized, because it wouldn't be my wish. So sometimes that forces me to leave others who are a bit fair, and I give attention to these ones who are critically ill. And yet in actual sense, medically, you're supposed to give treatment on time to every patient. But when you say that now let me solicit the worst one first and then others follow.
Unless maybe get somebody to cover you. But always we have a lot of challenges, but we only just try to work out among ourselves to solve that problem. Otherwise, we don't have particular days, maybe school days, or going to the church. You may find that the whole month, the 2 months, 3, you are not doing it for prayer. So you maybe have them at home over the TV and the rest. Otherwise, you don't have particular days for you to rest for those very big days. In fact, this is specialized hospital that the mothers who are supposed to come here are mothers to be attended for specialized services. But you find that most of the referral hospitals nearby, just find the mother, somebody coming for a normal delivery is being referred with the fake referral information. So we find that we are overwhelmed with the work, of which we will be having a very nice work, because we don't be attending to those conditions which are very sensitive that they cannot manage at the health center. But you find all the health centers, even the health centers for where they MOs, you find them referring to the hospital. So our major challenges, we are overloaded with the mothers and the mothers from nearby referral hospitals or health centers.
What do you have?
Because most of them in the health centers, most people want to stay down. So towards the weekend when somebody wants to come to town, yes, everybody who is supposed to be see that, or even a normal delivery, they just look at Mbale. So for us to receive everything, that's the problem.
3, they should be 9. If the health center 3, they are working 10, they should need 3, they should be 10. That is expansion. That's what we mean. Together for other people who have to be promoted. Like now, how she has gone to school, she's a registered nurse. She's here, midwife, she's a registered midwife. Her role, job description now here, sounds different at the level of registration. And now, because she's registered, she can't hide that idea she got from school. She says now, even if I am earning little money of enrollment, let me use my knowledge which I have gone to school. Promotion is a problem because of restructuring. Cow you see here cannot do anything. They say wage bill. Have you heard of wage bill? Because it does not accommodate that health center 4 needs 5 midwives, needs 5 nurses registered. It is still squeezed. So we need expansion.